Hi everyone, and welcome back to our channel Paw Pets, where I share everything you need to know about taking care of your pets. Today, I want to talk about a topic that every pet owner should be familiar with: pet first aid. Why pet first aid is important. Pet first aid is a set of skills and procedures that can help you deal with common pet emergencies and potentially save your pet's life. Knowing how to respond in an emergency situation can make a big difference in the outcome, and can help keep your pet safe and healthy. So, let's get started. Basic. What should we have in the first aid box? The first thing you should have as a pet owner is a basic first aid kit for your pet. This kit should include essential items like gauze, adhesive tape, scissors, antiseptic wipes, and tweezers. You can also include other items like a digital thermometer, a flashlight, and a blanket. Common emergencies and how to respond. 1. Choking. Choking is a common emergency that can happen to pets, especially dogs who tend to explore the world with their mouths. Choking occurs when an object, such as a toy, bone, or food, gets lodged in the throat and obstructs the airway. Signs of choking include coughing, gagging, and difficulty breathing. Removing the object. The first step in dealing with a choking pet is to try to remove the object from their mouth. If the object is visible and easily reachable, you can try to gently pull it out with your fingers or a pair of tweezers. Be careful not to push the object further down the throat. Performing the Heimlich maneuver. If you can't remove the object or if your pet is still choking, it's time to perform the Heimlich maneuver. The Heimlich maneuver is a technique that involves applying pressure to the abdomen to help dislodge the object from the airway. Preventing choking. To prevent choking in your pet, it's important to supervise them during playtime and mealtime, and to provide them with appropriate toys and food that are safe for their size and breed. 2. Poisoning. Signs of poisoning in pets can vary depending on the type and amount of poison ingested, but may include vomiting, diarrhea, lethargy, difficulty breathing, seizures, and collapse. If you notice any of these signs or if you see your pet eating something they shouldn't, don't hesitate to take action. What to do? The first step in dealing with a possible poisoning is to call your veterinarian or a pet poison control center right away. They can advise you on what to do next, and may ask you for information about the poison your pet may have ingested. If your veterinarian recommends inducing vomiting, it should only be done under their guidance or that of a professional. Inducing vomiting can be dangerous if done improperly or if the poison is corrosive or caustic. Preventing poisoning. To prevent poisoning in your pet, it's important to keep all chemicals, medications, and toxic substances out of their reach. This includes household cleaners, pesticides, chocolate, grapes, and medications that are not prescribed by your veterinarian. 3. Bleeding. Assess the situation. The first thing you should do when you notice your pet is bleeding is to assess the situation. Is the bleeding coming from a small cut, or is it more severe? If the bleeding is severe, you should seek veterinary help immediately. Apply pressure. If the bleeding is not severe, you can apply pressure to the wound with a clean cloth or bandage. Make sure you use a clean cloth to avoid introducing any additional bacteria to the wound. Apply pressure to the wound for at least 5 minutes, and if the bleeding doesn't stop, seek veterinary help. Clean the wound. After the bleeding has stopped, clean the wound with warm water and mild soap. Avoid using hydrogen peroxide or alcohol, as these can damage the tissue and delay healing. If the wound looks deep or infected, seek veterinary help. Prevent licking and chewing. It's important to prevent your pet from licking or chewing the wound, as this can delay healing and introduce bacteria to the area. You can use an Elizabethan collar or a bandage to prevent your pet from reaching the wound. 4. Burn. The first thing you should do when you notice your pet has been burned is to assess the situation. How severe is the burn? Is it a minor burn or a more serious burn that needs immediate veterinary attention? If the burn is severe, seek veterinary help immediately. Run cool water. If the burn is minor, you can help your pet by running cool water over the affected area for 10 to 15 minutes. Make sure the water is cool and not cold, as this can cause further damage to the tissue. Avoid using ice or ointments on the burn, as these can also cause further damage. Cover with a clean cloth. After you've run cool water over the burn, cover the area with a clean, dry cloth. Make sure the cloth is not too tight, as this can impede circulation. You can also use a sterile dressing or a gauze pad to cover the area. Monitor your pet. It's important to monitor your pet after they've been burned. Keep an eye on the affected area and watch for signs of infection, such as redness, swelling, or discharge. If you notice any of these signs, seek veterinary help immediately. If the burn is severe or you're unsure how to proceed, seek veterinary help immediately. 5. Seizures. The first thing you should do when you notice your pet having a seizure is to assess the situation. How long has the seizure lasted? Is this the first time your pet has had a seizure? If your pet has a seizure that lasts longer than 5 minutes, or if they have multiple seizures in a row, seek veterinary help immediately. Protect your pet. During a seizure, your pet may lose control of their body and become disoriented. Keep them away from any objects that could harm them, such as furniture, stairs, or sharp objects. Do not try to restrain them, as this can make the seizure worse or cause injury to you or your pet. Provide a safe space. After you've moved your pet to a safe space, try to keep them calm and quiet until the seizure has passed. Turn off any loud noises or bright lights that could stimulate them further. Talk to your pet in a calm and soothing voice, and provide them with a comfortable and safe place to rest after the seizure has ended. Monitor your pet. It's important to monitor your pet after they've had a seizure. Keep an eye on their behavior and watch for signs of a recurring seizure, such as confusion, disorientation, or restlessness. If your pet has multiple seizures, or if their behavior doesn't return to normal after the seizure has passed, seek veterinary help immediately. Those are just a few examples of the kinds of emergencies that can happen to your pet, and how to respond in those situations. Remember, pet first aid is an essential skill for every pet owner, and can make a big difference in your pet's health and well-being. If you have any questions or concerns about pet first aid, always consult with your veterinarian or a professional pet first aid trainer. Thank you for watching, and I'll see you in the next video.